What would people gain from wearing a mask, and why are you opposed to wearing one yourself?
Well, I just don't want to wear one myself. It's a recommendation. They recommend it.
The guidance around masks has been confusing.
In the beginning, they said that masks were ineffective, and now all of a sudden, it's like you have to wear the mask.
The CDC reissued their mask guidelines on April 3rd to recommend that all Americans cover their face when leaving the house. This announcement followed weeks of conflicting information over their effectiveness. And if you still have questions, you're not alone. People are searching for face masks online more than any other COVID-19 prevention term. When the coronavirus started to spread in the United States, the CDC and the federal government repeatedly advised against masks, unless you had the virus or were caring for someone sick. But for the average person, experts said that they couldn't adequately protect you.
The average American does not need to go out and buy a mask.
So why the change?
We now know that about 25%, in some studies even more, of COVID-19 is transmitted when you are asymptomatic or pre-symptomatic.
Recent studies suggest that those who have the virus can spread it without showing any symptoms. This can happen through sneezing, coughing, or simply talking. So if you unknowingly have the virus, experts say wearing a mask can prevent it from spreading to others in a place like the grocery store or pharmacy. This is key given coronavirus droplets are believed to travel about 6 feet through the air. But it's still unclear how much a mask can help shield a healthy person from the virus. Some point to data from the 2003 SARS outbreak that suggests masks did play a role in slowing the spread. But there are still too many unknowns with this particular coronavirus. And some experts worry wearing masks could make people less safe because they can be uncomfortable, and if you touch a contaminated mask, you can run the risk of spreading it to your eyes.
They tell people they should wear masks or scarves or something when they don't have to wear this.
That being said, other experts believe masks are a powerful visual cue to keep practicing other preventative measures, like washing your hands or keeping your distance from others. Now, the CDC emphasizes you should not wear surgical masks or N95 respirators. Those are in short supply for healthcare workers who need them the most. But you can easily make your own mask at home, no sewing machine required. A bandana or t-shirt will do, although one study suggests a homemade mask with 2 layers of high-quality cotton is ideal. Just make sure to wash it regularly. To be clear, masks are not a foolproof solution, and there are still lots of questions about their effectiveness. That's because the medical community is still learning how this virus behaves. At this point, it's more about slowing the spread of the virus than protecting yourself. Think of it as your role to help those around you. But as this guidance continues to evolve, we can still practice things like social distancing, good hygiene, and covering our face to help slow the spread of the pandemic.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.